name's Josh Francis. In the places where I work, most people know me as Dr. Josh. I've had the privilege to work as a paediatrician in a number of different places here on Larrakia country, where we're meeting tonight, in Gunabidji country, in a place called Maningrida in West Arnhem Land, and in Timor-Leste, where my family have found a family, people we think of as our Maluk. And you might know me as Dr. Josh. In Maningrida, my adopted family will call me Bulanj or Ganyala. And in these places, I've had the privilege of caring for territory children, of walking with them through some of the most difficult journeys you could possibly imagine for a child and for their family, sometimes through really difficult circumstances that involve such grief and such loss. And in walking with children and with their families, I've had this amazing opportunity to learn from them and to understand from their own journey and to use that to inform my own. I want to share with you in this brief talk some of the things that I've learnt from these people. Many of the children that I look after here in the Northern Territory in Timor-Leste are affected by something called rheumatic heart disease, something you might think of as an old disease. Old not because of who it affects, but old because if you hear about it, you hear about it as something that used to happen to people, something that happened many, many years ago. But the reality is this is a disease of young people. It strikes people when they're children, as young people, as teenagers. And it strikes people at a time when they're just starting to find themselves and work out who they are in this world and to look forward to a future ahead of them. Young people like Vanessa is here with us tonight and has asked me to share some of her story with you. And it's a privilege to be able to do that. It's a brave thing for her to invite me to do. Vanessa's a brave young woman who has been through so much, and I want to share with you just a little bit of what that journey is. Vanessa was 12 when she first met Dr. Jen, who's sitting with her tonight, and me in her hometown of Maningrida. At that point, she had had symptoms for a couple of months, sore joints, she was becoming a bit short of breath. But she hadn't been able to get access to the one test that would have revealed the fact that she had rheumatic heart disease. We were in the community at that point, working with the community to check all of the children in Maningrida for rheumatic heart disease at the request of traditional owners, leaders within the community who'd said, come and check all of the children and train local mobs so that they can do the test as well. And so we'd gone and we were working with the local community on using ultrasound, an echo of the heart, a scan of the heart to look for rheumatic heart disease. We were hoping that we would find mild cases, that we'd find young children who had mild rheumatic heart disease who could get started on treatment and prevent some of the terrible complications that can happen if it's not detected, not found, not treated. When Vanessa had her echo on that day, it didn't find that she had mild rheumatic heart disease. It showed that she already had severe changes of rheumatic heart disease, and she was in the early stages of heart failure. She came into Royal Darwin Hospital and within weeks was flown to Melbourne for the first of multiple open heart surgeries. The first operation that she had failed, and she required a further operation, and after this subsequent operation, the valve itself that had been damaged was repaired, but the heart was weak. Vanessa had a stroke, and the whole right-hand side of her body became weak. She went onto a waiting list for a heart transplant, and we waited to see if she would recover. Vanessa will turn 20 this year, and she has continued to show such remarkable resilience and strength, not only in the way that she has cared for her own health, but in the way that she cares for her entire family and has walked with them through some incredibly difficult times over recent years and shows strength for her younger siblings and for the family around her. I'm proud to know her. So what is this old disease that affects young people? This disease that would strike when someone's young and lead them into heart failure in their teens and result in strokes for a 13-year-old. What is this rheumatic heart disease? Well, it starts with something very simple. It starts with an infection that might affect the skin, like the infected sores you can see on the screen behind me, or it might be just a simple strep throat. And in starting that infection, it sets off a train of events that can lead to rheumatic heart disease. Now, these infections themselves are common, and people will have had a strep throat or an infected skin sore before. But what we find in people who are exposed to repeated infections in their early childhood because of living in circumstances where they have near constant exposure to the strep germ that causes these infections is that the repeated exposure leads to an abnormal immune response where the body's immune system starts to fight not only against the germ itself but against itself. And that usually presents with something that we call rheumatic fever, where someone might present with a sore joint, could be swollen, they might have a fever. And you can see that and you can recognize the symptoms of it, but what is unseen is what's happening on the inside of the heart. The same abnormal immune response can affect the valves of the heart. Now, the valves of the heart are the bits that you can see on the video that are sort of flapping like this. They're kind of clapping in the breeze. And these valves are super important. Inside your heart, the blood is pumping through and it's supposed to go in one direction and one direction only. And as those valves or doors in the heart open and close, you can feel them close. It's what makes your heart beat. It's the same sound that you're hearing as those valves opening and closing. And as it closes, it stops the blood going back the wrong way, makes sure the blood's going the right way, keeps you healthy, keeps you going. Unfortunately, what happens with rheumatic heart disease is that inflammation that comes from an abnormal immune response can start to make those valves a bit swollen. It's like getting water damage to a door that then doesn't close properly. And these valves that are supposed to close and stop the blood going the wrong way don't come closed properly. And the rush of blue that you can see on the video behind me is blood pouring back the wrong way through a valve that's supposed to be closed. And if you've got a small amount of blood that's coming back the wrong way through a valve, you won't even know it's happening. It's unrecognizable. And in fact, it's an amazing opportunity when that's happening to diagnose rheumatic heart disease and start treatment that will stop it from progressing down the kind of path that leads to the complications that Vanessa has experienced. But if it becomes severe and you have a lot of blood coming back the wrong way, it pushes back through the heart and into the lungs and leads to heart failure, can lead even to death. And in that situation, it's only with access to cardiac surgery, to open heart surgery, that you can actually repair the valve. And those people who've had heart surgery then continue to live with the risk of recurrence. So why would it be that for many of you, you might not have ever heard of this terrible disease that I'm describing to you, that I'm saying affects children and young people, like Vanessa here tonight? Well, the main reason that you might not have heard of it is that in places like the US and Denmark, in the big cities in Australia, the rates of rheumatic fever and rheumatic heart disease plummeted throughout the 20th century. Even before the discovery of antibiotics in the 1940s, you could see that rates were starting to go down because of the improvement in living conditions, because people were living in cleaner, larger houses and becoming less and less exposed to the strep germ that leads to rheumatic fever and rheumatic heart disease. And then with the advent of penicillin and other antibiotics, these remain crucial parts of what we can do to prevent rheumatic fever and rheumatic heart disease, and the rates came down even further still. And so in many parts of the world, this is a disease of history. That is not the case for us here in the Northern Territory, in remote communities where Aboriginal and Torres Strait Islander people live. It's not the case in Timor-Leste. It's not the case in many countries throughout the Pacific and Sub-Saharan Africa and other parts of Asia. What we see here in the Northern Territory in remote communities are rates of rheumatic fever and rheumatic heart disease that haven't been seen in the big cities in Australia or in places like the US and Denmark for 100 years. In some communities, we see that more than 5% of children who are school-aged have been diagnosed with rheumatic heart disease, 1 in 20. And that doesn't even tell the full story. When we've gone to communities, at communities' requests and screened, we've gone to schools or community settings to check all of the children for rheumatic heart disease. If you go and screen and you go look actively for rheumatic heart disease, what you find is that in the Australian setting, more than 50% of the cases that are picked up on school screening are new cases that haven't been diagnosed before. In Timor-Leste, it's more than 90%. And so there are literally thousands of children and young people out there who have rheumatic heart disease and don't yet know that they've got the disease. And I find myself thinking, well, what can I do? I'm a pediatrician. What do I do in the face of something like this? Well, I've got ears. I've got a stethoscope that I don't mind using. It's a bit old-fashioned, but I can listen for the murmur that might give a clue to the problem that's going on inside. I've got new technology too. I've got a handheld ultrasound machine that I can literally carry with me in my carry-on luggage, and I can scan someone's heart and use my eyes to see exactly what's going on inside the heart to make a diagnosis. But what I've learned as I've walked alongside people from communities in Timor-Leste and here in the Northern Territory is that if I really want to make a difference, if I want to change the reality that's facing children in a place like Timor-Leste, if I want to be part of closing the gap in health outcomes that affect First Nations children here in Australia, then I need to do more than just that with my ears and with my eyes. I need to know what it is to really listen to the people who I'm working with, to listen to my patients, to their families and to their communities. I need to be able to hear what their priorities are and what they would want us to do and how we can work together to face challenges like rheumatic heart disease and so many others like it. I need to be able to see from their perspective and to use my eyes to look at the reality of the situation that they are facing. And in doing that, to walk side by side with them in a way that we would describe in Timor-Leste with the word akampanya. It literally means to walk alongside. We're part of a journey together. We're doing this together. I need to use my ears and my eyes to listen and to see the reality. And when we've done that, and we've listened to communities, and we've said, well, what are your priorities? They've been more than willing to share with us what they would have us do. And I want to share with you some of the things that we've learnt from them tonight. There are some big needs in the area of rheumatic heart disease. We are waiting and hoping that there will be a vaccine for the strep germ that could have a huge impact on reducing the impact of rheumatic fever and rheumatic heart disease. There's massive need for policy change that would address the problems of poverty, that would improve housing, that would reverse and take away some of the terrible ongoing effects of colonisation. But in addition to all of that, and in the meantime, what I've heard from communities that we work with is that there are children and young people right now who have rheumatic heart disease and they don't know they've got it. And communities have said to us, we want to find these children and we want to get them onto treatment. We don't want to keep seeing people go down this pathway towards heart failure, surgery and death. And more than that, communities have said to us, we don't need the cardiologist to do it. We don't need the cardiologist from the big fancy hospital with their big fancy machines who tend to dress quite fancy. Are there any cardiologists here tonight? Hopefully not. There might be some listening online. Some of my best friends in the world are cardiologists, and they're some of the kindest and smartest people I know, these people. But the reality is, when communities say we want to do something, they're not asking for something to be done to them. They're asking to be able to do something together. And the message we have heard is that communities want their people to be trained. Train our local Aboriginal health workers and Aboriginal health practitioners. Train the Timorese doctors and nurses. Give them the opportunities to have the skills to be able to hear and to see for themselves, to make the diagnosis of rheumatic heart disease and to be able to treat. And, you know, when we've started to look at this and to look at it properly, we've realised that not only is this possible, but it's better. It's better. And when we've worked with communities and we've seen that actually you can train Aboriginal health practitioners and Aboriginal health workers, you can train nurses and GPs to do this job that used to sit in the hands of the cardiologists alone, to be able to use technology, not only to hear, but also to see and to diagnose rheumatic heart disease and to put people on a path to treatment that can literally save their lives. And so I want to challenge you tonight that if you're interested in making a difference in the world, if you're interested in making a difference in the broad areas that people might describe as being global health with a particular type of need in mind, if you want to be part of making a difference in closing the gap in health outcomes for First Nations people in Australia, then please use your ears, and use your eyes, and don't rush to pick up your stethoscope or your ultrasound machine and see this as your personal mission to take it on and to solve the problems yourself. Use your ears to listen and to hear what people will say and to take their lead in the things that we should be doing. Walk alongside the people that you care about and you've come to serve in a way that helps you to see things from their perspective and to understand the reality of the world that they face. And you will find that people like Joseph Ditto, traditional owner, Gunabidji man, someone who has adopted me as son, will be more than willing to walk alongside, to akampanya in a way that helps us to see together, to learn together. More than willing to teach and to learn, for those who would also be willing to go on this journey and to do all of these things in order to help people's hearts.